Y bueno, se habrán dado cuenta de que tenemos speakers de gran talla, líderes en la transformación digital de la salud en México. Y tenemos la primera presentación que va a estar a cargo de un personaje de talla mundial. Él es Don Sweete, él es el CEO de SNOMED International y está aquí para platicarnos sobre SNOMED CT. La presentación de Don.
Don Sweete, director ejecutivo de SNOMED International, es el guardián de la terminología clínica de SNOMED CT y ha trabajado incansablemente para unir a las partes interesadas de todo el sector, construyendo y manteniendo relaciones críticas con sus miembros y socios globales. Don está a cargo de la dirección y la estrategia corporativa de SNOMED International y es responsable de todas las facetas del negocio, desde el contenido del producto, el soporte técnico, la gestión de las relaciones con los clientes, entre otras funciones en la organización. Don ha trabajado colaborativamente para compartir la estrategia de crecimiento 2020-2025 y la visión renovada de SNOMED International entre sus miembros, clientes y socios a nivel mundial para continuar la adopción y evolución de SNOMED CT a nivel internacional. Por Salud Digital le da la bienvenida a Don Sweete.
Buenos dias, good morning, everyone. How is everyone this morning? You feel good? I'm feeling really good because this is the first time that I've done a presentation since 2019. And I know all of you have been through quite a bit, so hopefully things are starting to get back to a little bit of normal. I want to start by certainly thanking all of you in the room who are delegates who have come here. I know you all have busy schedules. And things are very, very busy in healthcare these days, so certainly thank you very much. A special thank you to Pablo, Victor, and all of the event organizers. This is quite a room. It's quite a show. So you've done a very, very good job. I also want to thank the sponsors. These conferences couldn't happen without the support of the sponsors. So I've been here since Tuesday, had a number of fantastic meetings, met some great people, and really what's happening in Mexico really centers around these areas. Where our organization plays in these areas is really in the genomics space, the data analytics, big data space, and electronic health records. We do in our organization promote innovation, so we do a lot of projects related to artificial intelligence and machine learning. We have yet to get into healthcare robotics, and we do have device codes in our terminology. Really, the goal of today's presentation is to give you a quick overview of who we are, talk a little bit about the standard itself. It is not a technical standard, it is really a clinical standard, which enables clinicians to use it to code the information so that the patients can have a better experience and also a safer experience. We are a not-for-profit organization. We were founded in 2007 by 9 founding countries. The terminology is very large. Some people say that it's very complex and hard to implement. I would suggest to you that if done correctly, it's very easy to use. We also have a number of products. So we have SNOMED CT, which is really the large terminology. We have global patient sets. We have maps that are freely available. The biggest map that we maintain is SNOMED CT to ICD-10, and we're working on ICD-11 now. We also have an international patient summary terminology. This is something that was supported by the G7 countries, And the global patient set, the maps, and the IPS terminology are free for anyone in the world to use. We also have open source tooling, and so those who want to use SNOMED CT can effectively come to a site and download the code. They can develop those tools, and all we ask is that if they do something that might add or enhance the tools, that they provide that information back to us. From a services perspective, we're a bit different than most standards organizations. We have 50 full-time staff. Our job is to effectively maintain the standard, but also provide dedicated customer support. We provide implementation support. We provide translation and support for those who are doing translations. Education, we have a number of online courses, basic courses and courses that are effectively for developers, for those who wish to develop content. We also have product documentation, and that really relates to also guidance on how to use the products, and we have a help desk. And I can assure you that I look at the help desk myself at least once a day just to make sure that our terms of service are being met. We are member focused. We have now 43 members, not 42. El Salvador has submitted an application to become a member. We also have active stakeholder engagement, and I'll talk about that a few slides down. So this gives you a sense of where we are in the globe. And the dark areas, the dark blue areas obviously are members, and then we have light blue where you can see that there are people that use SNOMED CT, but the country is not a member. We've done pretty well. We were 28 members in 2015. We are now 43 in 2022. We've just late last year, we received information from the European Union that will allow us to cover all of Europe with SNOMED CT. They will be subsidizing member country fees, and we expect the remaining 9 countries to join very, very soon, either this year or early next year. I should mention before I go much further, this presentation will be translated into Spanish, and Pablo is going to be doing that, and so it will be available for everyone if they want to look at it. We've started to see in Mexico some affiliate use of SNOMED CT, and that means that it might be an individual hospital or clinician office. It could be a group of hospitals. Asociación Health Tech Mexico has been a recent thought leader regarding the use of SNOMED CT. And here's the good news for those wanting to use SNOMED CT in Mexico. Since its inception in 2007, SNOMED International has always had a Spanish international release. So everything we do in SNOMED CT in English is also available in Spanish. We also, over time, thanks to the work of those in the community of practice, effectively have education courses and other artifacts within SNOMED CT that are being translated into Spanish and have been translated into Spanish. So I do want to thank those people who have contributed to all of the other items that are now in Spanish, and we will continue to do that. Our hope and goal is, because we have so many Spanish countries that are working with SNOMED CT, our hope is that group of countries eventually will take over the translation as we move forward of the international release and work with us to continue to maintain it and keep it updated. So I want to talk a little bit about SNOMED CT. So SNOMED CT is effectively a clinical language. Think of it as something that is machine readable and something that has description, logic, and hierarchies. It is not software, but what it does do is enable software vendors and those that wish to put SNOMED CT into their systems is to code every interaction that a patient has with the healthcare system. And the beauty of that is really the fact that we have numerical items that code each description. And we also have relationships. So if I appear at a hospital and I have chest pains, in a perfect world, the doctor would tick a box and that would be coded with the concept and description for my chest pains. As the clinician moves through his review with me, he can then make a diagnosis. All of the symptoms would be coded, the diagnosis would be coded. And if the clinician had a system that in the background used SNOMED CT to effectively write rules, they could write rules that would allow them to say, I have signs of a heart attack or a myocardial infarction, and that I probably need to have some tests done. And that would pop up in a software window and the clinician could click yes, and that test would be ordered. The beauty of the standard is it doesn't matter what the clinician calls certain things. There are a number of terms for heart attack or myocardial infarction. They all go to one concept code. And countries and users are able to use synonyms to ensure that the clinician always sees the information in the language they're used to using and how they describe things. Also, more importantly, it allows them to effectively move that information if they need to, if there is a specialist referral, or the specialist could fetch that patient encounter from the clinician's record if need be. We are used in a number of areas. Really, from research, we conduct a number of projects with researchers, and they do a number of projects on their own. And they code in SNOMED CT because it allows them to consistently collect the data and represent the data. We also look at how we can be consistent with data entry and the integration of that data. Then we get to clinical information sharing. So in the UK, I was a resident of the UK for 3 years, and I was amazed that I could see my electronic health record at the primary care level. I could see it in the clinical representation. I could see the SNOMED codes and the descriptions. But more importantly, when I went to a hospital in the UK, true fact, they actually could fetch that record and see what my drug allergies were, what my relevant patient information was, and can make very informed decisions on what they needed to do in order to solve my problem without giving me something that I may be allergic to or something that may cause me harm. When those various operations were over, the beautiful part was when I returned home and was sitting in my flat in the United Kingdom, I got a call from our primary care provider who said, I've seen that you've had these operations, I see you have these meds. If you need any help, give me a call. To me, that is how we start to improve the patient experience. And that's enabled in the United Kingdom because they have mandated SNOMED CT for use throughout the country. That also gets down to the next point where the clinician can actually then start to query. So what happens if I'm a patient that has two conditions. Most clinicians work in their offices by themselves, and they may have never seen someone who presents with two conditions. And what if the clinician provides treatment to solve one condition, but it causes harm because there may be an adverse event with another condition? If the systems are connected, both primary care and potentially tertiary care, the clinician could do a very quick data search, and within a matter of minutes could find out how many other physicians have faced the same two conditions, what they did, and what the outcomes were. That is a huge benefit for having the ability to use a terminology and have it interoperable. From a hospital perspective, from a government perspective, even a regional perspective, if all of the systems are using SNOMED CT, then you can start to take a look at population analytics. And is the monies that are being spent on healthcare being spent in the right areas? I'll use an example in this case from my home country of Canada. When SARS broke out in Canada, we were using Post-it notes to track interactions with people who may have had SARS. And if nurses were practicing in two hospitals, they were using Post-it notes to denote where they were. And this was not that long ago. So, Canada has a public health system. That is its primary way of caring for patients, but we are a federated model where we have 14 provinces and territories that don't necessarily get along all the time. But the one thing that they did do was they developed a national public health surveillance system that in real time, using SNOMED throughout, can get information from doctors' offices, from the laboratories, and from the emergency rooms if they need to. And it was mostly used in Canada because it's quite cold up there. And for those of you who haven't visited, in some parts of the country it gets to -40 below, and in other cases it gets even colder. So we're susceptible to influenza. And so it allowed the federal government to ship the right vaccines to the right place at the right time. When the pandemic hit, this was a way for them to monitor COVID outbreaks and take action immediately in order to support the provinces. And lastly, as always, there is an ability to do management analytics to see whether or not the health system or a portion of the health system is effectively being efficient. I'm not going to go into this in any great detail, but we have a number of benefits, not just for clinicians, but also for governments and for patients. And really, the big thing is, on an individual side, your experience is better. From a population perspective, governments and regions can effectively start to manage the health system. And really, that is the power of SNOMED CT. Here are some examples, and I'll just pick on a couple of them. So, North York General Hospital was struggling with their order sets. And they had a huge amount of various order sets that were effectively being developed by clinicians with no rhyme or reason. But they started to use SNOMED CT in their system and determined that they could use evidence-based order sets coded in SNOMED CT to help reduce mortality. Kaiser Permanente is probably our showcase implementation. Kaiser Permanente is based in a number of states in the United States. It has 40 million patients, and they use, I guess you would call, a Kaiser version of Epic. And what they did was, very early on, was they used SNOMED CT to code all of their information and to translate all of the information, the back information, so that they had really a longitudinal record coded. And that allowed them to do a host of things as it related to patient pain management, reduction of drug costs, and the ability to communicate with the patient and have the patient see information that they need to see in order to help them be engaged with their care and help improve their care. The most recent in the Hangzhou region, they use SNOMED CT for COVID surveillance before Germany was a member. They asked us if we would translate our COVID codes into German. We did, and they used it throughout the pandemic as a way to monitor COVID outbreaks and also track vaccine deployment. And then probably 6 months later, they sent us a letter and said we would like to be a member. But there are a host of these studies, and we do have a independently developed value proposition document that goes into much more detail with case studies and also economic benefits that can be derived from using SNOMED CT. So one of the things that helps us immensely and makes us stronger, because we're not always right, is the fact that we need to have a strong community of practice. The community of practice for us are the ones that I would say keeps us honest, keeps us on our toes, and works with us, sometimes in a very rigorous fashion, to make sure that we don't drop the ball in what we do in working to move things forward. So we have advisory groups, and you'll see them listed there, and they're very lively groups, and there's a lot of people that can join, and we'd be happy to have more representation. We have clinical groups, and we would like to see more clinical engagement with what we're doing in SNOMED CT. I find it interesting when I look at the help desk. I think at least once a week there's a clinician that logs in and says, I think you're missing some codes. Can I help? And for us, that is the joy of being interactive with people. We have a number of project groups, and these groups actually end up usually improving SNOMED CT or how SNOMED CT is delivered. And so I'll point out the one here where we actually are working with HL7, and we're working with them to make sure that our SNOMED is fire enabled. So HL7 fire would be the transport, and we would be the payload. We also really are part of a bigger ecosystem, because SNOMED CT and no one standard can be all things to all people. And so for us, we have well over 30 collaboration agreements and partnerships. We have some in content, and right now probably the most important one in content is social care. We also do a lot of work with organizations on mapping, and most of these organizations we have agreements with. So we work with them to ensure the maps are available for people so that you can easily connect to other standards. We also offer ref sets and free sets, and probably the two biggest ones there are DICOM, and the International Patient Summary. And we also have a number of other initiatives as it relates to connecting with other areas and other organizations to make things easier for the end users. And we're also working on more maps. One with HPO is probably the one that is closest to being completed now. So let's talk about Mexico. There are a number of ways, and we're not an organization that is very, how shall you say, colors between the lines but doesn't go outside. We're very flexible. So we have member licenses, we can have affiliate licenses, and those are paid licenses. But we also have development licenses. So if an organization or a vendor wishes to try SNOMED CT out and work with it for a while, then a development license allows you to do that at no charge. We would give whatever they need, a piece of SNOMED CT, and they could work with it in their software or within their clinical domain and determine whether or not it's right for them. We also have humanitarian or public good licenses. And in these cases, one of the original mission statements of the organization was for the betterment of humankind. And so we will give public good licenses to those researchers who are trying to promote things to make life better. We will also give it to those organizations that serve those least able to help themselves. So I know there's a lot of work going on in digital health in Mexico. One of the things that I want to talk about here is the opportunity for Mexico and anyone who is interested in doing interoperability in Mexico. Right now we're part of a group. There is HL7, there is IHE, there are ourselves, and there are a few other standards engaged who have developed the International Patient Set. It is a set designed to move information for those who may be moving between regions, moving across the country, moving outside the country, or coming to a country for medical tourism. That IPS set that SNOMED has is free. So the full IPS set for all of the other standards is also free. So there is a huge potential and opportunity for organizations and potentially vendors in Mexico to look at this as a potential to test drive a solution for interoperability. And that at least gives you a sense for what can be done and also what the pitfalls may be. So that is out there. We are here to help. We're here to work with Mexico. We're not going away. We want to be here to help you through the digital health strategy as best we can, so we're ready to support anyone who wants to do this through implementation support, potential project support. All of those things can be discussed. So we're ready to work with you, and we're quite honored to be here and quite excited to be here as well. That is my presentation, and believe it or not, I'm actually ahead of schedule, which is unusual for me. So thank you very much for listening. I appreciate it.
Thank you, Don.
No problem.
Great. Well, Don, maybe someone have a question?
I was hoping they wouldn't.
Yeah.
I will take questions, by all means. However, Victor, you may have to translate for me.
Okay.
So, anyone have any questions? That's a quiet group, isn't it?
How is function in Latin American countries SNOMED, for example, in South America?
So we have Uruguay as a member. We have Chile as a member.
Okay.
We have use in Brazil. So they have various hospital groups that are using SNOMED CT. We have instances in Colombia. We have been in discussions with Paraguay, and we're eager to get to Peru. We also, we do have a customer engagement lead for the region, and they've been in touch with PAHO as well. And we're quite, there was some mention in meetings yesterday of a project that PAHO may want to do that would cover Latin American countries, and we would be very supportive of helping and working with that.
Hey, Don. First, thank you so much for this presentation. I thought very informative. And it really shows the potential of SNOMED to collaborate in these Latin American countries. We have several projects ongoing in different Latin American countries, and we wanted to know if we have to, or now that we want to integrate with you, for example, how would we get in contact with you? Would we have to go through the Canadian SNOMED, or do you have representatives in every country?
We have customer engagement leads in every region of the globe, not specifically for each country, but we do have one for North America, South America, and the Caribbean. And we have others that cover the other part of the globe. The best thing to do is contact those customer engagement leads. Shelley Lippon is here. If Shelley would stand up. She is at the very back of the room. She's waving. She is the lady to talk to today. Get her card. I'm happy to give out my business card as well. We're happy to put you in touch with whoever you need to talk to. The customer engagement leads would, if it's technical, would put you in touch with our technical group. If it's content related, they can work with you on the content side, similarly with implementation or education. So that's not an issue for us.
Over here, Don.
Oh.
So I know for a fact that in the affiliate countries that you have throughout Latin America, they offer open access to your terminology, to your standards, and everybody within the country can use them to develop and to apply it to whatever they're developing. Could you please give us a brief rundown of what would we need for Mexico to become I'll repeat that because it cut off. What would it take for Mexico to become an affiliate? What the effort would be, and also what the main benefits would be, please.
So if you, and it's not an affiliate, it would be a member country. I think that's what you mean. If you're a member country, Mexico has to fill out an application and submit it, and the board would vote on it, and you would be approved as a member. There is an annual fee for membership that is determined based on where you stand economically. We're a very fair organization. It really mirrors what is done with the World Health Organization for determination of fee. That's an annual fee that allows anyone in Mexico to use SNOMED CT for free, avail themselves of any courses, also implementation support, tooling support, mapping, all of that is included. From our perspective, the big differentiation between being a member country and being an affiliate license holder, which may be a group of hospitals or a research group or a vendor, is you effectively have a seat at the table with all of the other countries. You get a say in the strategy, you get a say in how the organization moves forward, and you also have the ability to nominate people to go to a host of various groups that work on SNOMED CT. So that allows you a much more influential role in SNOMED International and SNOMED CT. I hope that answered the question.
¿Alguna otra pregunta? Okay. Thank you, Don.
Thank
it's an
you.
honor having you here. An honor always.
Thank you, sir.